next topic is going to be on health and wellness. How can we take care of ourselves in order for us to be able to give to our community? For this topic, I am going to ask Julie, Vicky, to come and moderate this one. Thank you, Vicky.
Thank you, my dear friend, Achayo, Joyce. Okay, I'll take that back. Thank you all. I think I've spoken multiple times today, but I'll introduce myself again. My name is Julie Amana, but in the community I'm known as Vicky. So that's the name. When you call me Julie, not a lot of people will know who you're talking about until you mention Vicky, then they will link the name to the face. This session is session 6, and we're going to talk about health and wellness. So we do have 2 presenters that will be speaking to us today, and they will be bringing with them experience, knowledge, and a lot of wisdom that we as parents or we as Equatorians could take home and help change who we are so we can live a healthy life. The topic that we have today we're going to talk about is community members' health and wellness in Canada. So under that we have a category of men. So we're going to speak about when we look at health, what specific things affect our men. We want to understand, and some of us are not from the medical background. I think having members that are from that background will really empower us. We're going to speak for women health, youth. Our youth are here, they have empowered us quite a bit with knowledge, but we do have also to learn more about the adult. Children, youth and children well-being. So the objectives of this session is chronic illness for men. So a male will be speaking under that, and the objective is to expand knowledge on chronic illness, especially common to Africans. There are some chronic illnesses that we are susceptible to, and I think that will help us kind of look out for the indicators. The second objective is to share recommendations on best practice for chronic illnesses and management to maintain good health and quality life. And we all agree that, knowledge is power, and that would help us take care of ourselves better. And the third objective that we're aiming to accomplish here is sharing information about general maintenance of health. As you all know, when we age, things start to fall apart. The bolts and on the joints starts to fall off, so we need some knowledge in that. And some of the highlights, of course, chronic illness caused by lifestyle choices and healthy nutrition, substance abuse, and all of those things contribute. So our first presenter for this evening is Dr. So proud to mention that the more we have doctors within our community, I think that brings a lot of, again, wisdom within us and education and awareness. And this today is about awareness. So Dr. Victor, his first name is Frankie Victor. He is a freelance medical writer, general physician. He's done clinical research and health communicator. He has earned Bachelor's of Medicine, Bachelor of Surgery. He has experience in outpatient and emergency care, single-handed patient care. He has postgraduate diploma in clinical research with honors, and he has extensive medical knowledge that he's going to bring to you and I tonight. He makes friends and loves movies. He has a YouTube and he's going to speak to all of us more about that. I think I'm just intrigued and couldn't wait to go home so I can look into his videos and start to support him in that regard. Without wasting of time, I would like to invite Dr. Frankie Victor. You're welcome.
What we're going to do is actually to remind ourselves about what is taking place in us. Because everyone here, if I ask him, he will say, "Ane Deo, defini gamo kile o dere gamo kile." Menina yala na baino fishunuga hase. Wa ma haja jadi kulu zor kuraro fishunuga hase yala na baino. Ana ino kalama rolusini kulu. إنك نذكر كلمات هناك الآن مهم لنا قال mindset واشتغل شديد كل حاجات دي اللي حول شنو حول صحة لنا المهم صحة كويس ما بقدر انجز حاجات الناس كانوا ينجزوا بيها فاحنا كلنا عايزين نكون عندنا صحة كويس صحة عقلية كويس صحة جسدية برضه كويس. This is what we're going to discuss today, the chronic illnesses and men's health. Well, I got this term from the sheet of goals and objectives given to me. But I think we cannot discuss men's health alone without human health. I know there's a women presentation coming, but in all, they're the same. Because we cannot say that man is having better health or women is having the worst one. Let us listen to this video to know where we are as a blacks here. Please.
There are so many factors that influence our health and well-being. How active we are, what we eat, how we handle stress. But so much of our health is actually determined by factors we have less control over, like our environment, our culture, and our race. For example, we know that there's a huge gap in research related to Black health issues, and there's significant disparity in health across the lifespan among Black Canadians. These are my colleagues. They study the health inequities of Black communities. We know that people of African descent in Canada are more susceptible to certain health conditions, such as heart disease, diabetes, respiratory diseases, and cancer. We know there's a lack of knowledge about how symptoms present in Black patients, and that these patients are more likely to be undiagnosed or untreated compared with their white peers. We know that people of African descent have poor physical and mental health outcomes, and less access to healthcare and health-related resources. We know that there are more barriers to education experienced by Black children, that proportionally, fewer Black youth and young adults graduate high school and attend post-secondary institutions. We know that Black children and youth have fewer opportunities for recreation and leisure, and experience more barriers to sport, physical activity, and play. We know that Black communities live nearer to hazardous sites in Canada, that environmental racism is significantly impacting the health of people of color in Canada. Here at the Healthy Populations Institute, we recognize the long-standing history of systemic racism that has led to the disproportionate rates of chronic disease in Black Canadians. We are lucky to have great scholars leading a flagship project that aims to reduce health disparities among Black communities. Will you help us understand these disparities in health? Will you be our ally? Thanks for coming by, the HPI.
All right. That was a brief introduction about our status of mental health among the Blacks here in Canada, and I think it has given some overview about what we're facing health-wise. With this graph here, I would like us not to go through it all, just but to concentrate on what. As I put the title there, how are we doing in diabetes? That means how diabetes is affecting us, or what is the magnitude of diabetes in our community. If we just see there, in the black, this is the black. That means anything looks like this in this group, whether for both sexes or women or men, this is a black community. That means the first column here, and the first column here, and the first column here. If you see among both sexes, in black community, we are doing this much. And in diabetes terms, and for women, we are doing this much. Diabetes, and for men, we are doing that much. How do you feel about it? The critical chronic illnesses causes, let us just try to find. Kelina and official hasil, al-kutana kodo amrad al-muslim, chronic muslim kodo zolgish mo zaman tawil. Ajat Allah bukutu fetibar the lifestyle. Lifestyle is nasa ko kadira lela. Poor diet, yani zolga ko lakel mabawis. When we say poor diet, sometimes you may misunderstood it or misunderstand it that maybe it's a maga kolo ish kifaya or it's a maga kolo laham kifaya. Lakini nama mana to poor diet is no ma potuatin. Akil ma yani balanced diet. Then higher sugar. Higher sugar here actually another problem. If we see on the table here all very much sugar on the table. In front of us here. And those pops there, ilapet, manian, sugar. And we think zola gaso divide zone mortal, low consumption of plant food. I put plant food here, I mean ajat al-akhadar de qadarawat, al-fugo rafet kifaya, and yani min al-khudar wa fawakih, fruits. And if we go to Canadian diet chart, there are fruit anna kullu sana bifetish. Kullu sana Minister of Health Canada bitala chart fi chart with the خريطة كده فوق وريلة تبعكله لحم قدر كيف تبعكله إيش قدر كيف تبعكله تعصب لبن قدر كيف. فإذا كان عينه في حتة بتاعتنا لو consumption plant food أنا نشوف الخريطة دي بورينا ناكل كيف. في مرة أنا لقيت في نفس الشات ده حكومة كندا كلمة قال شنو. The government of Canada said, if you want to be healthy, eat what your ancestors used to eat. You know, some of us even forgot what ancestors used to eat. Karakada, Korofulubina, Ajadi, Nabigasa, Burger, physical activities, Aloha, Nashat Badiri. Nashat Badiri, Moyum Diten. Zola guide inactive ما قاعد يتحرك ايضا لظروف صحيه او هو بس يعني شاعر في نفسه. طبعا هنا عيال اختلف شويه ناس ثانيين عربيه ما بكون بدي هنا لازم عربيه بكوني تضع فوق الطوالي هنا في كان وصل في سوبر ستور ذاته دير في سوق بلوت الجنبه وما دير احد هناك في بلوت الجنبه وفي عربيه بكون Jawab boys. Smoking. Smoking kita pada waktu kecil. Sejarah, tobacco, vaping. Anar vaping. Jahat kalau di syabab kecil gitu. Unas suka kalau ada hadis, sudah ada tipi, pernah seringkan mau suka ada batal, no. It is one of the means where we consume toxins to our bodies. And طبعا ناس اللي دخلوا pipes ومننسى second hand smoking. نعرف second hand smoking حتى راجل في بيت ممكن يدور يعني بتاعه والنسوان بتاعه والمرة بتاعه. وفي شغل زملاء بتاعك برضه they can affect you with that second hand smoking. And it has been proved. We try always in research to relate lung cancer to smoking with the active smoking, but we found that some people reporting with lung cancer, they were just exposed to second-hand smoking. Then we go to too much alcohol. That طبعا نوتو كثير واحد ممكن يبدأ من إنه ده بيرة بس وده واين ونبعد نمشي للتاني وتاني وتاني وبعدك مشاكل ببدأ مشاكل في الكبد مشاكل heart problems and cancers. المشكلة الكبيرة إنه بنشوف ممكن يجي بعدين في قدامنا بنشوف إنه الكحول لما يأثر على الليفر ببدأ يتغير وفي النهاية بتكون عندك كانسر بتاع الليفر اللي هو بيسموه هيباتوما. ستريس الناس يمينا الستريس عليها كتير. الستريس ممكن يحصل أي وقت اللي هو يعني بعربي كده اللي هو ضيق من القحص يعني قد تكون ستريس مباشر وقد تكون غير مباشر. There could be direct stress and there could be indirect stress and with different modalities. Could be psychological, could be social, could be relation, could be financial. أجل كثير بقدر أعمل ستريس. حتى زي قوانا لليلة من صباح العدسة ده برضه جزء من ستريس. كلنا واجه في stress and poor mental health. Those stress and poor mental health is all guided أثر فوق كتير. يعني mental health هنا ممكن تحطه في صورة بتاعه يعني أمور ما ماشي كويس معك. أنت بحاول اليوم ما بينجح، أنت بحاول اليوم إنك الناس معنا كتير وبرمجات في حاجات عايز توقف فوق قرار كمان توقف قرار ومشاكل أسرية ومشاكل مالية ده كله ممكن في النهاية يتغير لشنو؟ يتغير لضغط الدم، يتغير لأمراض بتاع القلب، يتغير لحالات بتاع مختلفة في إذا كان في الكبد أو في الجسم في المفاصل زي جبنا سمينا في سلوكات أمور ماشي ومسامير تانيين قلقة وحاجات من النوع ده. احنا نشوف البور هيلث مانجمنت. كل زول لازم يعرف انه كيف يعني البور هيلث بتاع المايند بتاعه. انا بقول شنو في الكلام؟ What do you guys mean by health, mental health management? Because you should have your coping mechanism in life. And one of those very important coping mechanisms in life is our family. If we don't have a good family, كمان ممكن أنا كتاب. أنا أسمع كلام كفاية. lack of sleep. نبغى بدأنا قالي بتوقف وتبينهم. لكن إذا كمان كلام كفاية يا أولاد أمراض بتاع حالات بتاع المرض ظاهر لك تكون obese. When you develop this obesity, for sure you will turn into insulin resistant. اللي اسم تمام بتتعامل مع insulin. وبالتالي بيتحمل كمية من السكر وتتبرع ثلاثين وده بيأثر في أجزاء تانية سواء كان في البيت أو في الأفكار صغيرة مثل الشبر إنه جسم كان ما يكون كويس بيفكر كتير أصلا أنا بعمل كده. أنا أفتكر كلمة الكويس الستريس بعربي بتجيبها يا هو أصلا أنا بعمل كده. نمشي لحاجات اللي يجيب أمراض المزمن substance abuse. ليه ندرس بدون substance؟ يعني مادة substance معناها حاجة ما معروف شنو لكنه بيأثر في الجسم بتاعك. أنا مشيت جوبا في 2010 We program in AMH Center for Addiction and Mental Health in Toronto. And I'm sharing the access to lobby with the Ministry of Health there to introduce mental health in South Sudan. And I go, this is not our priority. Our priority is malaria and diarrhea and so on. Then we take the city and the Undersecretary of Health, Dr. Anyways, I forgot her name. And I got, you know what? Our president even need counseling. I know, that's getting involved. Resolving mental problems. That's how I got the deal behind. But I think I'm going to check it out. I'm going to push the end of the heels. Resolve move to the substance, when I say substance, that means we have to take the gas, or chai, or cigar, or I was said to go, I don't know, the kind of gun or shot, we go to the cigar. But the cook, you know, talking about what's it? Yeah, I'm taking it out. And then the was an hour, there are some of the road is full, mandatory to the substance college. Yamani. Like that. Then, the different mashakil, the muscle of the credit, muscle of the Alwa mungkin rasa di mana kita berjabul da harm reduction program ini kan banyak finansiasi semua bertahun saya kan mereka tu lagi tu bukan al-mustamal fisik kita banyak erem tanya lalu kan tubuh negara pizol tadi isu kaman atau musuh domo Pak yang musuh yani kita tahu negara في أنا متى surveyed the research about this in Africa in the area of Mombasa. Bahala kita syawat ina nas disablan dia masa ini tak tahu substance isim musabita kemali masa ini tangga min sampai tergoleh terjurah kita tak tahu itu mereka tak jaya terjadi gol sabita sabta kalke kalau lain koi sana lagi jorok ada kalau lain apa min sabana mali go lain kalau mah muskil besilu juru ata resultan demo tangaru ikamil dapat bakter hasil ulu ata bakter hasil anda no vamos a Nenak kisah orang gelin ni futura utamarakan al-sahab. Now lagi we eat balanced diet, which contains all what we need, like fruits, vegetables, whole grain. That means here we should not depend much on this white refined bread. Now suya tu Raja Aufo and Ma 90, they put Mashaka at the table of this. And then the green Hanga Filatuka, I see the tone Namalo and the shot better than the other, we should exercise regularly. At least, there might point at least 150 minutes a week. Every time we get a kadab. We are from seeing the Riga Post or Amul Fogariana. They will go there. Then I school for an amigo. And I got a camp, a barn, and a room. And it's about the maximum. It's about the maximum for a week. Amuriana comes from Marakamana to the Riga Polo. Yom, agora estava negociando meu vamos sim de philosophy. Parei na Bahawal Jagab حاجات الليبل ده السجاير ومريسة عشان ما يسمى الأمراض الكثيرة. لأنه الجدل بيأثر مباشرة في النظام بتاع الجسم بتاعنا. حتى الأوعية الدموية تتكلم the blood vessels, those things affect them immediately. That's why things in the brain, things in the heart, things in the lungs, things in the kidneys, we cannot avoid them if we don't minimize it. Then again, Sabita Arawa National Management. في حالة أنا بعمل شنو management. The simplest way is to meditate. أنا بفكر الناس كلهم يجي نعرفوا كتب بتاع باين تبغى meditate في يوغا. هسا الناس بيقولوا على يوغا. أنا ما أعرف كم كيف بجيب يوغا برضو من رياضات الكويس. زمان كان يفكر قالوا إنه من دين إنه من سلامات. لكن قالوا كويس لجسم برضو. نوم. أنا برضو كتير قال كل نوم من 7 ل 9 ساعات بكلمة تكتاب. لأن نوم بيجا ما في ناس ما بينهم فاكر ما كويس لساعة. لازم زول يحاول يقدر يمكن ينوم 7 ل 9 ساعات في اليوم. And again, الكويس كان دائما protocol, the medical checkup, is like family doctor, or even more walking clinic, you can go for this medical checkup and petition is in the back petition, the bada, petition for bada. هنا ندري نعرف شنو حصل في الجسم عشان either we mitigate it earlier or we find solution to it before it aggravates to another problem in our health. So we have in Canada good thing with the health. Canada they have regular health screening. This is routine checkups, complete health evaluation. That is health evaluation. There will include a lot of things from blood work and X-rays and so forth. This is we can see how it works down here. Blood tests, cholesterol levels, blood sugar levels, liver function tests, kidney tests. There are حاجات الكويس بيساعدنا في كندا إننا نقدر نستغله ونعرف شنو بيحصل بالإضافة للإيميجينج including X-ray, MRI, CT scan, and other imaging technologies or techniques. We know that technology is developing very fast. Mungkin kita cakap itu orang lela, yang melihat nama kul aja mana dulu ada betul. Pukul kita cakap kul lagi hanya tak kala jadi kita ramai, kita ramai kita kalau fi muskilatan kita dulu. Mata persisten ada kelas alena kalau kuis, that is it no. Whenever they say you come for it, you come for it. Now a little bit aware of certain symptoms in hajat al-naga aselarama, the higher yomina, and explain weight change. Weight change, not necessarily you're losing weight or you're gaining weight, both either important. If you say that tell us again, what a good mashallah. It's a guy who tell us good, what a good malita. Take lose weight and you're looking good. كانت تشوف الأمراض التانية مثلا الأعراض اللي بيكون في persistent fatigue يعني تعب في الفتور. biara bidana lari kita bukan fakaran kulo kita mar kita bukan kita minum kita bekerja kita minum karena kulo kita lazim tasal doktor di kalangan asal kamalek fosan awja fi jisim fi mafasil fi ajzat al-jisim tani زي ما قالوا لي بلدنا مسامير خلاص بقى هل هي لازم رجع روضو digestive problems يعني نفاخ وإمساك وإسهالات إسهال أنت ما تقدر تسبرين أنت ما أقول حاجة بتال وأنت ما أقول حاجة الجسم بتاعك ما بس الجلوس بتاعك فيه إسهال وكان ما يجيب قوام فلازم أنت تمشي تشوف دكتور ومشاكل في الصدر مثلا أنت بقول لك ضيق في النفس يعني نفسك بقى 3 دقايق أنت بالمرات يحتاج تستعمل 2 مخدة أو أكثر من كده عشان ترفع صدرك لفوق وبالإضافة للقهة برولونج قهة المزمن والمستديم وعدم قدرة للتنفس كويس يعني أنت بكون جاي لما تنزل من العربية عشان تخش جوا ذاتك بيبقى مشكلة لأن في العربية أنت قاعد مرتاح أنت نازل من العربية عشان على بيت كده أنت ما عارف تبص في الباب دي ده علامات ما كويسة لازم تشوفها. من ضمن الليسته اللي انا ماشي فيها لسه انت تحاول طبعا حسب الاكسس ممكن تشتريه في بيت. اكشن هذا الجهاز ضغط الدم ممكن تسال هيلث وركر بتاعك يعلمك كيف تقراه وممكن عشان تعمل ريكورد بعدين حتى في اجهزه حسب ممكن تربط مع التليفون بتاعك اي حاجه حسب الجسم بتاعك ممكن ينزل في التليفون وبعدين تعمل ما في تمشي للدكتور بتاعك يوريك الحاصل شنو في الجسم بتاعك. عشان كده نحن بنقول انك تعرف تقيس البلاد بريشر والبلاد شوجر وهارت ريت لانه لما تجيبه بدون سامبل ما منتظم جهاز البوريك معناته في حاجه ما ماشي كويس. ثاني حاجه لازم نعرف بعض الاعراض للاجزاء المهم معينه في الجسم بتاعنا مثلا زي القلب والاوعيه الدمويه اللي هو كارdiovascular system diseases. لأن بنلقى بيكون في أوجاع في الصدر ده أمراض اللي ممكن يوري إنه في حاجة في زاوية قريب معك أو يوريك إنه في ستروك بتاعي قريب معك. فإحنا لازم نعرف الأعراض دي اللي هو أنت بتشوف إنه في chest pain في palpitation يعني ضربات في قلب بيدق بسرعة أو يميز ضربات بالمرات لا انت تعمل حسابك منه تبلغ الدكتور. then business يعني دوخه بدون سبب وده خطر في السواقه العربيه. انت بتكون ماشي او واقف او في مطبخ او في حمام يجيك دوشه كده هنا تلاقي 3 درومه انت لازم اسال نفسك في شنو قاعد حاصل. الورم في البرين طبعا الورم في البرين ده بتحصل لاسباب كتير لكن برضه كويس انت تناقش مع زول المعالج ده. بالنسبه للامراض بتاعت الكلى برضه ورم في البرين وفاصل الانكل and change in urine. انت بتشوف انه تغيير في البول. تغيير في البول كيف يعني؟ تغيير في الكميه بتاع البول انت قاعد تقوله، كميه في عدد مرات انت قاعد تقوله، كميه في او تغيير في اللون بتاع البول القديم والزمن البول بيجي فوق بالليل ولا بالنهار. ده كله انت تلاحظ تشوفه كاسل بتاعك انت تناقشه مع الدكتور بتاعك. زي ما انا قلنا جهاز فوق هناك تقيس فوق بلاد بريشر. اذا بلاد بريشر بقى هاي برضه لانه ممكن نتيجه للستريس بلاد بريشر ممكن يمشي فوق ويجي راجع بدون اي مشكله. ده نجي ثاني اللي صاحبنا دايابيتيز يعني. دايابيتيز زي ما انا قلنا من الاعراض بتاعه الناس كله بيعرفوا جينا عشان كتير تازا مويه كتير اي وقت وتاز وبولو كتير انت بكون نظر بتاعك بكون برضه تشاش كما قاعد واقف في بلاد فيجن. then اذا طول معك بتحصل حاجات زي كان في حاجه بسيط جرح ما بقول لكم. في مرات الامراض بتاع الصدر in respiratory system we will find that في ويز ممكن بالمرات بتسمع صوت في النفس بتاعك تتنفس بس سيك لازم تاخذ بالك منه، وفي بقعة أو كرونيك كوف، أو في يعني باستمرار يكون لك التهابات في صدرك. في صدرك أنت تمشي للدكتور يدوك علاج بعد كم يومين ثلاثة ثاني في التهابات. لما في مشكلة في صدرك أو مشكلة في محلات ثانية اللي يخلي صدرك يكون فوق التهابات دواء. بعدين نجي نشوف كانسر يا جماعة شنو؟ كانسر طبعا بالمرات ما بعرفه. وكي تعرف بيبقى تولي أو بقول لك باقي أيام أو ده نوع كانسر ثاني. لكن أغلب كانسر هي أنا بنفس الناس كله سواء كان رجال ولا نسوان examine your breast. طبعا الرجال كل قال لي إحنا بنexamine برضه في كانسر بريست للرجال ممكن بومز للرجال. فكان في نوم تexamine نفسك بتاعك في نوم في حاجة ورم شوية كده أنت ما متأكد منه وجيله منتلين في عملوا ماموجرام وحاجات دي بعرفوا ده عندهم ورم ولا هو كانسر أو في unexplained bleeding. Unexplained bleeding here can happen from anywhere. من النفق بتاعك، من كسمة بتاعك، من سيكابول، من دهن، من أدانا، أي محل قاسي فوق bleeding. إذا ما تقدر explain, please report it and let them find out what is it. لأن ممكن بعد bleeding يمرنين كان بكون ما فوق كان. بعدين na kamar da shi ro ta ga for granted na ga na sa so ne skin cancer ma ga hasilana da ma hakika skin cancer ba ga hasilana wo aina nas akthar nas din mashakil fi jild يعني ده بقول شنو شامة الناس اللي قال علامة جمال ممكن يحصل في أي محل فأنت لازم تتابعه هل هو يتغير ممكن يزيد في مساحته في عدده في ارتفاعته في خشونته ده قد يكون سبب مشكلة ثانية كبيرة. difficult يعني difficult in swallow يعني صعوبة في البلع صعوبة في البلع ده غالبا بيكون في تجارب عنده سرطانات كتير جدا كتير بعد من لسانك لحد التهجئة لحد أنبوبة المرأة to the esophagus and stomach down a lot of cancer. ليه؟ لأنه area ده is an area of turnover of cells like let me say highway high traffic high traffic way إنه بشوف إنه ظهر اللي يتأكل طوال ولازم يعملوا construction طبعا كل سنة بيقفلوا سكين يعملوا ريبيان هناك نفس الشيء حاصل لأنه ما بوجي بقولشون أكلنا وتاني بنشرب وماشي ففي نهاية الحال شنو الخلايا الجسم بيحاول يبني حاجة بالمرات خلايا بيطلع برا من القانون بتاع الخلايا يعني النظام بتاع الجروث بتاعه بيطلع برا منه وبيكون سرطان ده هو كانسر بيجي هذا بيستعملوه طوال بشيء بيطلع برا من قوانين بتاع النظام وببدأ يعني يزيد كمية أكثر من الدواء مثلا يقولوا عمل لنا زلط 2 سنتيمتر يقوم يعمل بام أكيد لسه أنت في حتة أننا نعرف في شنو قاعد يصير في الجسم بتاعنا. في أمراض جينية أو genetic predisposed conditions that will cause illnesses in our bodies. Can it be a family member? Can abuta or not? Can it be a معين عرفوه وقال ده يوم له أو مات منه فكمان تبغى ترجع الجامعة الدكتور بتاعك عشان ما يفتشوا كان في تاني بس الحاجات دي If you have certain genetic tests, that is the certain factors or indicators of a specific disease. When they get it with you, you will know that you are going to get this disease. It is possible now, even journalists have told them back there on those certain tests, Parafocal can do a review to Jalo and genetic testing is very important. It is not possible, but from the history, you can tell and know some risk factors that you might have embedded in your system. Then we come to lifestyle factors and habit. Again, we go back to diet and exercise. We know that we need to exercise well and eat to a balanced diet and having good habit. Habit of the cigar, the thing. Can tell you this type of habit might better stop it or minimize it so that you don't get into trouble with this. Then comes here if somebody is using any substance, we agree to call it any substance, Kargat or Kanzigara or Marisa. But let us be careful of using those things in order to minimize their danger. Mental and emotional health. There ذكر حاجة both the two Korean ladies who are here. I think they were using the word mindset a lot. But without mental health, you cannot have a good mindset. Mindset and about like mental health, you will not have a good mindset to endeavor to those achievements. We need to have a good mental and emotional health. Emotional, let me also say something here. In our houses, sometimes somebody might be suffering emotionally bad within our house, under our nose. And we will be the cause, and we continue insulting the emotion of that person. By the time the person presents with the real mental health, you say, "Malu mara ne kodinu, malu ra jele berkata kodinu." Tarau kan nanga ho sabab sah di jabal kodinu tu. Bana lazim baik mo balu kois. Yahuda shafi dinak, ana bamu ke anxiety. Alua netinya dari Eropa, Malaysia, hukum segala, ayahnya anxiety ni tamar betul. Itu satu gangguan muncul, yani like a fear of unknown. You just there, you don't know what is happening. Then you need a counselor to explain it to you. You go through it, then you understand what is going on. And these two can, those situations when they happen, they can cause chronic stress and mental health conditions that could both be a cause of and symptoms of chronic disease. Here, what does it mean? That means sometimes Zolbara complain, I have to say, مشاكل نفسية وشنو تراو في مشكلة كبيرة. بالله يقول لنا ما Zol guy gaga, Zol guy stressful, and ما يعرف شنو بيحصل وشنو. لكن في النسيان في مشكلة في جسم بتوعنا كان فتشوا على اليوم ولا بكون كويس. أو كان ما مشكلة بس تبقى في كلام قديم حصل في زمن الطفولة أو في زمن من أزمنة في حياته يدوب كوريوس حسب mental manifestation. يعني بس ما كنت بعد أحيانا بفكر تركيز ده كله كوريو في حاجة ما ماشي كويس في الجسم. mood change مزاجات يعني تبقى زول مزاجك تتغير كثير. بالمرات لأن مزاجك تتغير كثير وبرا نديله أسماء تانية أمكك أبوكك وما أعرف شنو. ده ما مشكلته. هو زول تعبان كده كلسة أبوه. فأنا لازم أفتش له طريقة ثلاثة. غير بقول فيه هو كان يكون عنده حبوب اللي هو depression، يكون عنده anxiety، يكون عنده مزاج متقلب. This كله بعد وريده في chronic health problem there. إنما قليل جنبه. هنا في جزء مهم ثاني هو كيف نفتش how do we look for medical advice. This can come through consulting healthcare professionals. يعني تتكلم مع طبيب المعالجة وممرض المعالجة بتاعتك. In case of أنت كان لاحظت حاجات الناس ذكرناهم في البيت كله. Then also sometimes you need to meet a specialist. يعني زول المعالج بتاعك لو شاف إنه في حاجة الأعراض بتاعتك قاعد يدل على حاجة معينة كده ممكن يحول للسبيشاليست. وأنت طبعا إحنا عارفين في كندا to meet a specialist is not easy thing. Very long waiting list. Better be patient and be punctual. Someone I will let the guy تعرفه يوم 3 شهر 6 السنة الجاية. أنت تعرف يوم 3 شهر 6 لأن كان تجيلي ده كما بيقول تاني شهر 3 السنة الجاية. We can, if you get that opportunity, we can visit those specialists like cardiologists, endocrinologists, pulmonologists, and oncologists. That they us with that gully, with that غدد وفي ناس بتاعت رئتين أو صدر وفي ناس بتاعت سرطانات. Again here listen نشوف كده أنا نقدر نعمل شنو عشان نعرف شنو بالصحة بتاعنا. اللي هو self monitoring tools. زي ما الناس ذكرنا قبل. في عالم بتاع التكنولوجيا حصلت فيه حاجات كتير. ممكن نستخدمه ممكن يقرا لنا حاجات اللي جاهزه في الجسم بتاعنا. امثال قدام زي ما ذكرنا فيتنس تراكرز، سمارت واتش، فيزيكال. دي الحاجات اللي ممكن تعمل عشان انت تكون في حاله كويس فيزيكال اكتيفيتي، تشوف ضربات التجارب بتاعك الريت بتاعك اللي هو اجين تشوف نوع النوم ذات نوع النوم. انت قد تشكر في النوم ونوع تشغيل كيف. في حاجه بتسموها سليب ابنيا اللي هو بيحصل انقطاع التنفس اثناء النوم وكان ما يرجع. وكان في حاسس زي زول كانوا قاعد يفتن اثناء النوم لازم يشوف طبيب هيدرولوجي. طبعا هو التليفونات كله مليان ابس يومين ده ما مشكله. طبعا تشوف اب كويس تقدر مونيتور سيمبتوم بتاعك. Now here the call for action. What do we take away? الكلام الكثير نقوله. I think I propose here that you be proactive. That means you have to reach out for your needs. You do the monitoring of your health. You see any change, you take care of it. You recognize symptoms. You seek regular medical advice. That means to talk to your medical caregiver. And with my humble self, I would also be happy if somebody reaches me and try to know my opinion about what is happening. We can share the idea, the information, then we see what we can do. I am not saying that I'm going to treat you, I don't have a license here, but maybe I can help you how to think about it. Then, you should not ignore anything, any change happening in your body, or anything that you see is damage to your body. You have to take care of it. Therefore, at the end of the day, early detection and intervention are crucial in outcome improvement and maintaining good quality health. Thank you very much.
Thank you very, very much, Victor, for this powerful presentation. And we're actually gonna invite you to sit, and we're gonna invite the second speaker to come, but I'll speak to that first, and then after that we'll have a panel, and then take questions, and we'll open up for everybody to kind of ask you both questions at the same time. Once again, thank you so much. That was a profound information. We appreciate it. All right, now that we heard about how the man needs to take care of themselves and look out for all the signs and symptoms so that at least we'll continue to manage those bolts on the joints and make sure that they don't fall off. As we have looked at the health wellness of the men, one of those screenings, I think some of us lack that knowledge. I think it would be good for us to know moving forward. Provide insight on when and how to have conversation with family doctors regarding safe family planning. Oh, this is a good one. And women health, sharing information about general maintenance of women's health, access to health care. And the highlights will be addressing community members' challenges to access appropriate health care in our highly restricted public health care system in Canada, type of common women's health condition experience at different age of life, 30s, 40s, those are the young, 20s, 50s these days. Share recommendations and best practice for common women's health conditions and appropriate management measures. Help women and our community members become empowered and effectively advocate for critical access to the right health care. Oh wow, I am the presenter for today is my friend, Ms. Feidi Okita. I'm going to give a little bit of a brief biography of who she is. Feidi has a degree in nursing. She completed her Bachelor's of Science in Nursing at McMahon University and Master's degree in Gerontology at University of Fredericton. She has worked in various healthcare settings, including intensive care, palliative care, medicine, program management for long-term care, and is currently a case manager with Alberta Health Services. She is passionate about medicine and geriatric care. Without wasting any minute, I would like to invite my friend, Feidi. You're welcome.
I'm not a good public speaker. I often get frozen, so if I do, just throw a bottle of water on me and I wake up. So my name is Simone. I like calling better, but I guess because we're talking medical, you have to get my name that's on license. So Feidi Okita, and thank you so much to Vicky for welcoming me on, and also to the ESSCA community of Canada. I just want to say this is one of the best organizations that I've had over the year. And even if I wasn't able to make it in today, I needed to meet you guys and say, this is a great call. So thank you for having me here. So being a nurse, for those who knows me, I did my nursing at McMaster at Hamilton. And nurses, we don't have time to write properly, and also to do a beautiful presentation as what my fellow colleague did. And disclaimer, I'm also not so good in Arabic. So some of the presentation that my good doctor did present, the nurse might have not known the prescription. So there might be duplication because of language barrier. So just bear with me, okay? I'll try to go quick. And again, I'm not going to explain everything because human anatomy is the same thing. When we look at a woman, and they're different because of Zulu, my uterine where we make the babies. So that's going to be my focus for this because the doctor pretty much touched on everything. Chronic diseases in men and women are the same, but I'm going to focus on those key anatomy that we carry so preciously. So women, stay with me. Also men, okay? Oops. Okay. So the agenda of today is going to be just general knowledge on women's health, preventative care and screening, managing chronic diseases, which I'm going to touch on so briefly, as well as how to have that conversation with the doctor. Because sometimes we do not know when to really say, okay, is this going to be an adult kind of situation, or I need to get my foot out and call in sick? General maintenance of health. Like I said, women and men were pretty similar anatomically, and so we were going to have similarly what the doctor already mentioned. And I will talk about some key area how to access help, especially in Alberta, where I've worked for the past over 10 years. Thank you. So again, the PowerPoint might be so squinting because I did kind of put it in part of note, but I'll try to go through some of the information as briefly as I can. So when it comes to describing women's health, this is a huge area. We can take a whole forever years to just go through the whole thing. But in medicine, it is a branch of medicine that focuses on what diseases and conditions that affect the woman's physical health. When that woman says physically, I am sick, that mama has a lot of headache, a lot of pain, a lot of things going on. The bills are not even paid. So our sickness usually encompasses so many things, not just what we could easily treat, but there's always a combination of things. So that's why we say it's a physical health as well as the emotional well-being. In a little nutshell, let's say when a woman is going through the hormonal changes that when they're having her period, man, listen to this. We might be sitting there looking moody. We're sick. Physically, we might not be sick, but emotionally, for some reason, the hormone has just messed up our body. So that's the time when the king should come in and say, Mama, you'll be fine, okay? So we also are going to talk about breast cancer, ovarian cancer, and osteoporosis. For example, me, I'm in my early 40s, I shouldn't say this. I have older children, I have 4 children, so even if everything's so good, my knees started to crack sometime. So we'll talk about how to make it work longer. And obviously, as the doctor mentioned, we've got a lot of similar conditions like heart diseases, which is very common. So preventative care and screening. So how many of us has a gynecology? By show of hand. 1, 2. Do you have a gynecology? Perfect. I think I've only seen about 4 hands. I don't have one either. So it's really important to have a regular gynecological checkups, which include a woman who you will feel free, touching your pelvic and pressing and just having that kind of physical checkup and looking it from a woman point of view. And another he also, when we talk about cancer, has mentioned in the gender, we have what we call pap smear. Pap smear, by simple description, and I will give you guys my nightmare about this. So, clinically, according to the Health Canada, it recommends that it should be done to any woman age 25 and up. I also went ahead and looked at the NTI, which is the American website. They also recommend from the age of 21 to 29. So which means Canadian we're in average range. And then I also looked at CCI. I knew I would have some of them straight here, which is the Canadian, they call it Cancer Council Institute in Australia. They're also asking it to be done from the age of the 26 to 30. So we're pretty much within the laptops. So pap smear are basically what you do. And when I first did it was after my first child in Alberta. Also my kids were born in Ontario. And they just walk in and just put the thing in my, pum, pum, pum. To be honest, I was traumatized. I felt I was cut. Then I took the time to really understand what pap smear means. So in simple words, now they actually have a modified machine. They basically have a little machine that opens our pelvic, and it has a brush inside. So that brush will go in and swim into her cervix cell, a little swim to take some of the sample that will be microscopically viewed for any of the things that cannot be seen. The good thing about pap smear though, if you have any STI or any other diseases, it will be also caught at that time. So even if we are looking from the cancer point of view, it is also a good thing to see other things that can be discovered. And so, again, we start at the age of 25, and if you're a healthy person, they will always want you to do it every 3 years. That's pap smear. The next, pap smear basically focuses on the ovarian cancer, the cancer of the uterus and the other one is breast cancer screening, which we talked about before, mammogram, the doctor mentioned about it. That's a little bit older, not like at early age, because when it comes to breast, actually, when you're young and your breast is still locally open, it is easy to detect anything that's different from the breast anatomy. But as the girl gets a little saggy, it's kind of hard to tell. So the Canadian also recommends to start at the age of 45 all the way to 74. Americans are a little bit earlier at the age of 40 when we're already doing mammograms. So with mammogram, it's a very quick X-ray. They just basically take you in, put the girl in the straight position and take a quick, literally 10 minutes. I've done one just recently, it doesn't take long at all. And so that will show if you have any lumps that you cannot feel with your hand or your gynecology cannot feel, So that is part of the mammograms. And in Alberta, we're so lucky lately, you can actually get this done anonymously. I'm going to show you guys how to book it. It doesn't need your doctor to follow you. You can I'll show you later on the website how to get to that. And the other thing is we call it fecal colon blood, the fit test. So colon cancer, this is also key to men, especially in the Black community. We are not so good when it comes to laxatives, so house tools are very, I see that what comes out is quite hard. So we are very pumped to having colorectal cancer, the cancer of the colon. So basically, it's good to have your blood tested for that. And you can just call and say, hey, I need a fit test. They'll send you and give you instruction how to take your little from there. This is both for men as women. Again, this has been extensively explained, so I'll be pretty brief. So for the lady, because of this childbirth, we have a lot of what we call uterine and bladder prolapse. When you start having it, don't panic. It is normal because, we have children and things just getting a little looser from carrying pregnancy, as well as also what we do in our day-to-day life, So obviously seeing the doctor and talking about what to do about it is important. They obviously will introduce you to do some physical exercises, as well as time to try to just make your pelvic floor, more, to give it more strength. If that fails, we have lots of genosis women thinking that they have mesh. You can have a mesh. The king will not know. Okay, I didn't say that. So they'll fix you up. So just take a lead. Don't sit and just be here by yourself. Sometimes too, because again, childbirth and everything, we start to say, like I've been sitting for long, I might cough, and later on when I go in, my panty has something in it, a little bit incontinent. If it's once in a while, maybe because you've been sitting for long, it is okay. If that dribbling is coming all the time, that's also something you need to see a doctor for, because incontinence is not normal regardless of how old you are. So this is where we have to start thinking hard, okay, is this incontinence happening because maybe I had a lot of caffeine? Is it happening because maybe I was drunk, or what's going on, So these are the our conversation. So again, as we spoke about, and the doctor had mentioned that clearly, things like symptoms that you need to watch for and really take a lead and see that you need to see a medical person. As simple stuff such as coughing and a cold, we can have all that's very common. But for sure, if you've been coughing for more than a week and heading into 2 weeks, please call in sick. Go and get checked. Again, you have fever, for 1 day, 2 days. I wouldn't even wait for day 3. I put day 3 because that's what's clinically indicated according to Health Canada. But for me, as a sister to you, I'm telling you when you have a fever for a day and then tomorrow you have a fever, please go in. Get checked up. Digestive issues, the doctor has also spoken about that, and stomach problem, and if you're eating and sitting up in the bed and you feel like the food is backing up, at a certain age, let's say as a woman as well as a man, at age 40 and up, we do have issue with our thyroid glands, and so we might need some medication to help just for a short while to try to see what is happening to our gut health. Why is the food sitting up? Why I ate an apple satisfactory after I went to bed, and the food, I just feel like it's sitting there. So once in a while, if you had like a chunk of barbecue and some beers, you pay the price. But if it becomes a concern the time the food feels that way, you probably see your doctor, get some checkup. For the women, again, it's the bleeding the doctor talked about, please blood, we don't want to lose any blood. We need to see any bleeding, we need to run in for sure. For the women, abdominal pain, I want to say today that from the researches I've done and from people that I've worked with, menstrual period, our period shouldn't be that painful. A little bit of cramps on the first or second day is normal. If your pain is beyond what you could do on your day-to-day, and it's all the time, consistently, you've taken a warm shower, you've gone for a walk, you're not constipated. Sometimes, when we have our number 2 backup, we get a lot of issue. Because when you're plugged from the back, we have a pipe. You better know the doctor mentioned that. So it might also cause our period to have the pain. But if you know all of the issues are not the case, but your period is so bad all the time, you need to see a doctor. You could be having a condition that we call endometriosis, which is something that can be treated when it's discovered early. You don't want to wait until it becomes a chronic condition where they'll have to take you from what they call endometrial ablation In that case, if you're a young girl, you might not have a child because they have to scrap everything. So don't sit on anything. Again, trouble thinking, the doctor talked about that. Stroke. If you can speak clearly, once in a while, if you're tired, it's okay. But if you increasingly cannot find your wallet or your car key every day, madam, ask me what you're tired away. Like all the time, and you have slept well, but it's becoming quite common, you need to talk to your doctor. Probably you're having some TIA, which is a mini stroke. Because, especially if you're always okay, this is where I put my car keys, this is where I put my stuff, but increasingly you are very forgetful, you are lacking focus, you're always passing out on the couch, you don't know what's happening. Even if it's on your day off work, then it's about time to check with the doctor. Vision, you have a vision problem, like for me, I wear glasses by now, I have contact. If I have my glasses on but still I can't see, those are all changes that need to be checked, So when you notice changes to your body, and again, we mentioned weight gain, might I get, oh good, I'm looking great. If you need to follow up and see what is causing this sudden weight gain, or my, stress is what's going on. Unless if you intentionally wanted to put that weight on, because, in African culture, it's good to have good body weight. That's just culturally accepted. When you reach a certain age group, this is for the women. Sorry, to say. Every time when the period goes up. So now, our body is controlled by one key hormone we call estrogen. When estrogen decreases, remember when we're having childbirth and we're having this period, sometimes the hormone is way too much. And we are moody, we're not saying. As we age, the hormone gets too low. Remember, we already used to this, it's like a substance in our body. And now the behaviors change too. We are getting there cranky, we are feeling what we call hot flashes, we are down there, sorry men are here, and maybe the kids, you sometimes feel dryness. It's normal, it's just because that estrogen in your body is now depleting down by age. And for the women age, usually start at the age of 40 to 45. That's when we start having what we call pre-menopausal, These days, for some reason, the kids, even at the age of 12, they're already full grown. And it's the same with us in menopause. They're actually getting pre-menopause quite early. Even people at the age of 38, they're like, I feel hot, I feel all flushes, It was never the case in the beginning. So we do have a treatment, like talking to your doctor and saying, hey, I think I'm heading toward the pre-menopausal. I don't feel like seeing my king anymore. I feel dry, just listen to your body. And there's a lot of good things there in the market. We have HCR, which is hormone replacement, just to fix your mood. Because this is the time when you need to start enjoying the children, they're growing up. We talk about women in businesses, you need to be able to be back and doing your businesses. You don't want to deal with the mood from lack of that hormone. We didn't call for it. We're aging, it's getting less. We need to find a way to fix it. So, my question is how? How do we see a doctor? How many of you have a very good family doctor by a show of hands? And the rest are so healthy, or what happened? Did we fire our doctor? First I'm going to go with our website. If you have a phone, you can also follow through. It's called screeningforlife.ca. So now that is the tool I was talking about, anonymous testing I mentioned before. So you can go in and choose what it is. It has different anatomy of the body, the lung, the breast, whichever anatomy you want to focus on. You just click on, and it doesn't even ask you who referred you. And in Edmonton, we're actually lucky to show you location. Like this lady has it, this and this has it, so then within that you can locate where you can do your booking, Again, for those who do not have a doctor, community number, sorry, I'm so biased, this is where I live. I just know one step out here. But I also did put there, because I knew there would be some people who travel from out of town, contact your local public health. They will also walk you through. You can also ask them for how you can find a private Medicare center. So the first thing is go to verifyingdoctor.ca. So that takes you to primary care network. When you're within the primary care network, do not expect to see Dr. Abdul, Dr. Rahman, or whatever. It will give you a clinic location that's available. So just choose that clinic location to go to, and then that's the way of how they will, whoever will see you will say, okay, it looks like your clinic was located, I would like you to be my primary doctor. That's another way to do it. For our senior in the home, another good way to, we have lots of NP. I'm an RN, I don't take any patient, I just work for a company. There's an NP nurse practitioner, they have lots of mobile clinic in Alberta now. Their scope of practice has been expanded and they're great. So you could also go and ask, I just want to be connected to an NP who can be my primary. And some of these doctors do also home visit. Okay. So then now, how? We've done how to locate, find a doctor, and now is the time we book our appointment, we're going to see a doctor. Please make a list of questions and topics you want to discuss with your doctor. Because most of the time when you go there, if you're someone like me, when I see a new doctor, I'll forget. My husband knows this, so don't worry, he knows. I will totally forget. I say, when I walk out the car, I'm like, oh, I didn't even address the issue that brought me here. So just write your concern down and really step by step what you want. When you ask your question, prioritize your question, leading with the most important one. And again, when the doctor takes a turn to talk, write it down. If you can write, because some of the language I'm not going to ask my quiz. Record it, not really mobile these days. Record it, and you can go and share with one of your child. Again, if it is topic related to confidential thing, maybe talk to a friend or someone who's not a younger child. Don't put the children to learn about all this. It might be traumatizing for them. And then ask your doctor the preferred mode of communication. Some doctors prefer email these days. I put down the point that says patient and attentive when you visit emergency. Now, this is the pain that I go through every single week I'm in the hospital. We have our people that will go to emergency. There are people that find feeling like lightheaded and everything. This emergency for so long. You find someone, when their chances now, they're calling to come in, they went home. It's okay, you go home, but you do not know what these people write on their record. Okay? Leave without medical advice. For sure, this is a big point. Please do not have that on your file. And the fellow doctors spoke about, sorry, it's not my fellow doctor, my doctor, I'm a nurse. Sorry, doctor. The doctor talked about having the mobile app and also seeing your specialist. These days, we cannot see the specialist as it used to be. And majority of this is my Arab and the types where I really about the Sarana. Okay. Hello, Kilavatoli? Okay. This one is behind the scenes, I know. So, Johnny, now I'm language barrier. You can tell it happens anyway, so don't dispute. So Johnny, come here, we need to be cancer. You give me an appointment so that you will follow up appointment. Okay? Okay, initial and a doctor, from Igbo doctor, they tell you about they always take you to, they call it the cluster of CCI, group identity.
Okay, she's saying that if you have cancer, and then you go to the doctor and they have a... Oh, you better nail it, right? Okay, ini cancer and cancer. Ita karapi the determinant by the team that I had to Ijangeli be kakata ugati cancer kakata be.
So once they do that, they will decide who will be give OMB. Oh, Jesus, sorry, this is the weird moment ever. Don't remember this, we just remember our moment. So they will you want to okay, they told you don't very we are the being born
So they will assign you a doctor and say this is your doctor. No, what letter they told me that there they told like a Bijalo eyes can I had a man and cancer like that, then the Torah will there buying the Torah will best take up.
I don't know meaning I might be here.
The Karaban will let the Torah get to Batam.
They are the like when you're blacking or
because of our disadvantage. As an African and as well, we had a treatment and African about the cancer will a treatment about.
So the very charge area, man, missing appointment team.
Yeah, can't miss appointment. The cancer had to be found a day and miss appointment.
And then kind of missing a Mario,
can't miss marathon.
The guitar along treated Igamanoti placebo, Madam K.
So can't miss marathon, Mabula be treated a Muslim matter cancer, the exam that could be a placebo, or Magoleta active tower. Best will let handle, just the placebo.
So now I can say this in English. So the testimony of the sister that I had, we lost a sister so closely recently, an entire year. And the pain that came so heavy was when I posted. I'm actually one of the social media thing. I have a lot of friends on social media, so I dance. And so when I posted this lady, because we had a moment together in Ontario just 5 months before she died, the lady called and said, "Oh my goodness, is this your friend?" And she could not even talk to me first. She said, "Did you see the file?" I said, "I cannot. She's my friend." She started crying. So that tells you guys what I want to is something that we can right there. So just specialist appointment like the doctor mentioned, go for your this is the time this is when your moment will come at any time. Lady was in the hospital for 3 weeks. 3 weeks, nothing. And so that's just what I mean by being patient. Try to be on your best side with the specialist and with anybody you don't. Because the first impression, you do not know who the person you're talking with. The first unless you know them, then now you can start bringing out your own frustration, but don't do it on the first day. Sorry for taking that long, but I just wanted to be out there. So the doctor mentioned and did so well when it comes to maintenance of health, and so I'm not going to repeat so much about that. We're just going to talk a little bit about access to health in Canada. All citizens and permanent residents have free access to Medicare, we call it Medicare, which is something that we used to call universal care. Over the first year, obviously, Canada, we're declining a little bit in terms of healthcare. Our wait time has doubled. Someone spoke today, the first speaker about working in Canada. There's a lot of vacancy in the medical field, so we have lots of long wait time. But still, you can still get pretty much good treatment. Most provinces, like when you move, let's say we have a lot of new faces. If you decide to move, to Alberta, most of the provinces will have 3 months wait before you can get your healthcare card work. But
without burden. The moment, if you can't validate and you apply for it right away, even if you're not eligible, the moment you give your application number, don't worry if they have to charge you, they will backtrack everything because you did the application. So just make sure you apply for it. And BC only 2 months. Other provinces like Ontario and Newfoundland, beautiful Ontario, no wait time, you get your access right away. Calling health links is very important. It's just 811. It's open 24 hours. If you have something that you're not sure what it is and you do not want to go in, some of those nurses are very amazing. You can just, they can walk you through on what is going on and give you advice as that. General maintenance, like I said, I'm not going to focus so much. We already spoke about exercise, about the mood, about everything. My only question is, there's one point that I mentioned here, again, the hormone. Hormone actually, when we do meditation for the women, it helps a lot. I've taught my mom a little bit and she's quite okay. Her blood pressure is going down. So I don't know if they're watching this. So it does help with the hormone relaxing because most of the time that lack of hormone actually put us into that kind of you have the kind of responses whereby we get quite anxious, quite irritable, and obviously when you feel like that, the blood flow to the body rushes faster, and that's how the hot flashes come, by the way. That's the simple way. So if you can meditate, please do it. Religiously or however you like it, it works and help. Every of us has more than one job. You don't have to put your hands up if you don't want to talk about it. This is lady. More than one work, like job from job to job. 2 of us. Yeah, we do that because we want life to keep going. Great, good job. So the only thing I'm saying is that we are trying to do that because we are, most of us that are the survival mode. You understand when I say survival mode? You are just basically working from this area to the next, to the next, to the next, and completely have no time to relax. So relaxation is very important. Most of those employers has vacation hours. Please use them, okay? Just tell them to take a break and use them. Something that I should have say on here, but I'm going to say, there's also mental health payment. You can go on a stress leave and get paid for the whole as much as you want. You know, just tell your doctor, my mind is not happy, so take care of yourself. And I hope it will try to improve on our health and be as strong as we are already. Like again, the main focus here is to listen to yourself, slow down, and just take care of yourself. It is that one body that you have. If you don't take care of it, you won't have another one. And if anybody wants to read most of the information that I've shared here, you can go to NCI, which is National Cancer Institute, Health Canada website, Alberta Health Services, .ca, Health Lane, and also PubMed. Those are all evidence proven resources that you can punch in any information you wanted to look for. And you can also call Susanna, who knows everything from what I know. And we have lots of people in the room here. Thank you.
Sit here and we're going to invite back Dr. Victor, just because you guys have given us a comprehensive presentation of health, and I'm pretty sure the audience have some questions that they would like to clarify or comments that they would like to add. The first question, and any one of you can answer that. I know that sometimes as people, when we go to see our family physician, and sometimes when we are going through some pains or some struggle, and sometimes it's so hard for them to actually recommend or put a referral, or maybe X-ray, MRI, ultrasounds, sometimes those things are not, given easily. How do you think we as people can advocate for ourselves so that at least we get what we want? So that at least some of the answers that we're struggling with is being answered by the professional. So be it MRI, be it this or that. I per se experienced that and had to advocate for myself. But what would be the encouragement or the right wording or, for us to do that?
Yeah, that's a very good question. From my point of view, and also from what I've gone through, it still goes back to taking a lead of your health. The community is now coming up with great initiatives like having us here who can talk to you about what is recommended, sharing with a medical expert like a doctor and say, hey, I've gone to a doctor for this and this is what I was given and I'm back home. So maybe he can say, if you feel like you have a TI or some symptom of stroke, was MRI ordered, was a CT scan brain ordered, So those are the things that you can go back to the doctor and then also talk to the doctor about it. And Alberta has a very good mobile app, like the doctor said, My Health Alberta. So make sure you download it. For you to have access into, you may have to call HealthLink. There's a number down on that website to actually give permission to have it. Then you can log in and check in, and you can review those blood work or anything that looks abnormal. And I think it goes back to us speaking for ourselves and also looking for help within our community for expertise who can guide us. And then you can go to the doctor with those written questions at the right way and how to approach it, push for it. Thank you.
Thank you very much for having us back again here and try to answer some questions. Before I answer the question, I want to share with you my personal experience because I'm somebody of two experiences, two different experiences. That means I practice medicine back home, and I think there's some, because I also studied medicine here to get the license. With them I know what is needed of doctor here and what is needed of doctor back home. So I found differences of that. Back home, we may call it, we are British school. How the British do their thing, we learn what they do. But here they have also different system. And in most cases I don't share this, but because I don't want people to have the idea that, hey, he's talking like this because he's a doctor and he's not practicing it, he's jealous, he just want to make these people look bad. But this is not the case. I'm just sharing the facts that I know. The thing that I want to share, I can call myself, I am the victim. What you mentioned here, that sometimes you may not get the right doctor or the rightness, or not the right, in the word the right, but doctor and behavior who does not consider or take in consideration, or let me say another way, is prejudice, treat you in that way because of your skin color. My experience is that when I had the surgery for my back, which actually ended me on this chair, I was operated, major operation, 4 hours under anesthesia. I finished with me in the evening. I worked, they took me to the ward. When I woke up in the middle of the night, that moment I was still under anesthesia at the same time, and a very potent painkiller, metered one in my vein. Early morning I was discharged. Could you agree with me that? I was discharged early morning without even preparing for anything. No ambulance, nothing. I was very angry because I didn't expect that to happen. I left hospital, even I left my wife in the ward with a big wound in my back, in my spinal cord. I was very, very angry that you cannot tell, because if I meet my wife, I will transfer this to her. So I did not want to meet her. I just went, I took taxi. That means the nurse who was there in charge, to her it's not a big deal. You're just a black person, you're operated, go home. That's what happened. And those things happen, and it is there. And they are evident. Not me. You know, Serena Williams, she had a one such situation just because of color of skin. These things happen in the system here. But I didn't want it to be a big deal. For example, some people say you should have sued them. I don't have that money for the lawyer who will do that time for me. So, to put it short, yes, the system here is good, but still there are people who are not good. They can take decision and do something which is medical not accepted, ethically not accepted. So back to your question, what was it, the point?
Was about MRI, why does it take some time?
Yeah, this goes to back what I was saying. Here they have their protocol. The protocol here is different than we have there. Back there, me as a general practitioner, when I see this is the case I want to know about it, to that extent I can request MRI, I can request CT scan, I can request anything. But here they have protocol. And this protocol is geared towards preserving resources. Don't see those things there like that, they say it is free. No. It is that the resources should be preserved. You as a family doctor, if you start referring people to specialists, anyhow which you think that the specialist will do better service, the report will come there that you are just you are not taking good care of resources, like because you know that the number of consultants here are limited. They don't have enough. So if you're a general practitioner, you're referring people to a specialist, they will report at the end of the day, maybe after a year, report will come that the victim is just sending people there without making sure that or following the case well or doing this and something like that. So at the end of the day, what I want to say to answer the question is that be patient with your doctor, keep following your case, and keep him enforce him with more information till he will come to the state that yes, I need to do this because it is going and he has record. So he will refer you. But if you just think that there's any will refer you, you'll be prone to this.
And something to add on, I just remember, let's say you've been referred to a specialist. Also, it's good to ask your doctor. I've been waiting for this many times. Like which office did you refer me to? And sometimes you can call that office and say, hey, any cancellation? You're just trying to build rapport with them too. Again, it goes back to being proactive and taking care of yourself. Thank you.
Now, questions from the audiences?
Yes, we have one over here.
And now we have, okay, sounds good.
Hi, my name is Falco. Thank you for your presentation. That was very informative. You guys actually touched on most of the questions that I have. First of all, we have to put in our mind that racism is here, it's not going anywhere. So wherever we go to access medical services, we at one point we're going to experience that. Okay, you were talking about some medical like mishaps. For example, you're not following up with your doctor, you end up taking a placebo and all that stuff. And there are also gross medical negligences that are happening every day. And I'm worried for my people. Sometimes with the SSA, there will be language barriers, there will be so many kind of things. For example, childbearing age women. Like, some people ended up being sent home without delivering the placenta, you know, and they went home for 3 weeks, they were bleeding, they didn't know what was happening. They would call their healthcare provider, and they're not getting any answers. So we are being neglected, basically. So my question is, how do we navigate things like that? And if it gets to a point where I have to sue, where would I start from? You know, we'll think about our financial situation, which lawyer is going to take my case and stuff like that. These are very tricky and very, you know, discouraging things that are happening. So you guys already talked about it and you have experienced it. So I'm left with the question with no answer, basically. Because racism is there and we're not going to do anything about it. We get treated different, that's a fact. Simple things such as skin conditions. You guys are in the medical field, you guys know. I would be diagnosed for something which is not my skin condition because my color is different. They're not used to seeing someone with a darker skin color and they don't know they studied it in the white. And the other thing is, if you go for x-ray, for example, our body structure is different. You know, they'll put you against that board, and if you're not like aligning well with that, like, they will come and shove you around several times. Like I have a curve, permanent curve there. I'm graded that way. Like, what am I going to do about it? You know, these are minor aggressions that we face as Black people. How do we navigate this?
Well, thank you very much for this sensitive area. But the good thing is that you have already educated us about what is happening. I mean to say that from within your questions you have answered actually what is happening there. And the underlying element there is that how would you go about it, right? Going about it is not an easy thing because you need really to have a very technical report to back up your case. And to have that very technical report, that means you have to have a lawyer who is of that medical knowledge up to that level where you are facing the problem in order to gather all this information if it is not scattered. If they have not discarded it, they know that it's going to be a problem and they scatter it, then maybe, or discard it, there may be that lawyer. But here comes the financial, which was my problem, the financial issue. Here actually, experts are saying that maybe because of cultural differences, we need to advocate for training our healthcare givers about the cultures of different people. Because even going talking to them, like she mentioned earlier here, that sometimes the language of communication between you and the doctor, that is I mean to say, language barrier is another problem. So the experts are saying that because Canada is multicultural, there should be a system that to train people who are giving these services, or they should tailor service according to certain group. Like for example, which so many people do not agree with it, that this part of the hospital is for Black or this part of the for white. This is not acceptable, of course. But sincerely speaking, when you meet certain person, they have said something in mind already about you, and they will treat you based on that. And thank God, I always thank God. God created us very tough. Whatever they try to bring around us, still we can survive. If not, believe me, so many of us would have perished. But there are things being done just because God created us very tough, and we can forget that. I think I might have done something to convince you or? Thank you.
That will stay with you through the whole process of child care. And there's an action that was put in most of the healthcare in Canada now that we are allowed to videotape unless if you're not doing anybody's private part or you're not showing anybody's space. You have the right to know the conversation in the room. And you can say, language barrier, I want to make sure somebody can listen to this and make sure I'm being treated the way it is, you know. So you're being shoveled like that and you're just being treated, rushed through for x-ray, put your camera on and just say, I am consenting to record this moment. And because now we have this with our health information out, there's a lot of litigation now, rules that patients can actually record with consent. Don't just do it without them knowing, just tell them, I'm going to record this, I feel we're rushing through this. And sometimes that alone will change the language. So just fight for yourself, be vigilant, and like I said, don't wait until you cannot drive and you're alone there in the middle of nowhere. And you're very far away. So because we are too far away, don't just leave things alone, you know. I know we don't have all the great friends in the world, but just make sure someone is there with you to watch out. Thank you.
There's a question over here. I just want to add something as well. With the doula, this is just a resource for the young ones who are going to have babies. If you decide you want to go with doula, there is also a postpartum doula that will come after the baby's born. They'll come and stay with you for a couple of days, for however long you hire them for, and they will take care of your child when you're home, especially for the first-time moms. I think they're really, really great. I do use it with most of my clients. So that's just a resource.
In the things of I did medicine, but specialized in health economics, health policy, and management. And when I had two cases which specified, like doctors prescribing medicine and pain, surgery, and no consequences. The person who did this, I feel very sad. I have long experience working with Norwegian Board, and there are two institutions. The Norwegian Board of Health makes sure that if the doctor prescribes wrong medicine, they try to find out why this doctor prescribed the wrong medicine. So it has consequences.
Can you please put the mic closer because the people in the back cannot hear you? I apologize.
Oh, sorry. I just want to know the role of Canadian Board of Health and the role of Canadian patient organization. They call it patient on board. What are their roles? Like prescribing placebo medicine, somebody who did not make appointment twice is unjustified. So those cases must be reported to the Board of Health or to the patient care organization which cater for this kind of cases. What are the role of the Canadian Board of Health and patient care organization?
Thank you so much for your great insight. And I think if not, Norwegians are among the country with the best medical care. I think I know that from what I've learned. So basically what they do, they don't do anything that they will not be, that they will be put on to the court of justice. So you'll hear that a young lady who's still full of life, that needed to go for radiation and chemo and everything, they will just give you an almost saline infusion. You're just getting hydration. And so by the treatment list, you will know you're already being given comfort care, while you still feel they should be giving you active treatment. You understand? So then something might happen, maybe you're not feeling okay and potentially needing some compression and things like that. Again, they will say this is just comfort care. And the decision how they're making it sometimes is basically looking at the patient's journey toward the whole thing, how achieving, following the treatment, because when they schedule you to go for your CCI, which is Canadian Cross Cancer Institute here at the university. Those medications are very expensive. So they show if they waste one and waste the second one, the next time you come in really sick, you're not going to get that anymore. You'll be treated basically from the person who are being in different kind of medicine will know that this person is being treated as a comfort care. So legally, if you have a feeling that you know this is your loved one and should be still getting radiation, should be still having other opinion from other teams, should be doing this, that is not coming up. And the person could be on bed for maybe 2-3 weeks and nothing actively happening. You just see IV running, you see people moving around, but nothing clinically and actively being treated. I hope that answers your question.
Yeah, just to add something, maybe like the common question always here, somebody will come and say, what is going on there? What is going on there is that there is systemic discrimination, which is well established in the system. That's why it's not easy for you, like somebody like me, or who has no that ability of paying the best lawyers who can navigate those things there and find out exactly what happened and bring it out. If you have that ability, then you can go, yes, there are boards there which can punish such behavior. But is it because if we are all of the same, maybe human value, then I cannot allow you to do that. If you notice that it is in medical practice that ethically, when you notice your colleague is doing something not professional, then you can intervene, either call him and talk to him. But since it is in the system, then I will not talk to you because you are just doing part of it. See? Thank you.
Thank you for that. We have 2 hands up, and I think we're just gonna close it with the 2 questions. I have a gentleman here, and then Susanna. Then.
Thank you, Dr. David, for what you have just explained to us. I had a positive impression about medical doctors, and I expected that medical doctors, during their medical school, during their training, they had ethics, because the profession deals with human life, and there's no integrity regardless of what rights the patient belongs to. He or she, his or her life should be served in the way it is expected. But now, based on your revelation, I'm getting so concerned, which is really sad. And they say, because if you have money, you don't afford to pay a lawyer, you may be able to win the case, or so that the guy should be not the technical background in medical field. Okay. But in the past, there used to be what they call legal aid. Legal aid, you don't afford to pay a lawyer. Nobody can pay you legal aid to pay for that lawyer to defend you in your case. So in this situation, would you be able to get legal aid doctor, so legal aid to fight your case?
Yeah, thank you. From what you said, I think legal aid has a limit also. But things to that level, you really need to work hard. Because it is something connected with the system itself. That means once it is discovered that the whole hospital is going to go to problem. And they will not allow that to happen. They will fight you to the last. And with your minimal ability, you cannot reach them. Yes, I don't deny that there are systems in place, there are boards in place, that all those things are there in place, showing that if something happens, they can reach it and they can solve it. But if something happens, for example, as I said, we are not of the same race. and this issue of racism is there, it is well established in the system, then if somebody, one of them practice it, and the result is out, would they expose that person? No. They will cover that person very well, and it will be very difficult for you to expose that person, because when you expose the person, if you have that ability, the whole hospital may go for it. Then they will not allow that to happen to them. Anyway, this is, I think, not the topic that we're going to discuss, we're supposed to be discussing here, because it is going to create more fear in people, but this is the reality. Racial segregation is embedded in every system. It is systematic. Whether in school, in universities, in hospitals, everywhere. Like one time I had a story of the university in Toronto. A Jamaican student who graduated with very high marks, you know, Jamaicans with this Rasta hair. And the other, because when I say racism, I don't mean this Caucasian, Canadian, white Canadian, because we are simple races. Maybe the nurse who is telling me could be an Indian, could be Chinese, and the doctor who operated me could be Russian. But that person who is that authority to take that decision can just do that because he doesn't like your race. What I want to bring here is that this type of behavior, as we say, it is embedded in the system wherever, not necessarily in health. That one happened in Toronto. That young man, Jamaican, had very high marks, and he is supposed to be absorbed back into university and teaching stuff. But they graduating the masters there, the teachers or the lecturers, they don't like him, they want to bring somebody else from different race. And during the study, the system in computer taking everybody's email address. And they were discussing things among themselves. And the name given to that man is Dude. Dude is like this, you are not going to give him this position, Dude is like this, and his marks is supposed to be like this, and Dude. Then the man who was going to take that decision, I think, whatever his position in that thing is, he wrote down things there, convincing the rest of the people who were discussing this through email. And you know, email is very notorious. When it says send, it is sent. The thing went and landed in the email of our Jamaican brother. Then he took the thing, now he has evidence, took it to the university council. Then they now start rushing around and try to calm him down, and they give him what he deserved. But otherwise, was not going to get it. Thank to the email, internet.
Thank you. Due to time, we're going to maybe take the one question. And if anybody has more questions, I would encourage that maybe we write it down. And tomorrow also we could still address those if we do have the time. But for sure, we're really time conscious. So maybe that one we can take it.
I want to kind of maybe provide a couple of suggestions in the issue of advocacy. And, you know, Dr. Petro mentioned that racism in the system here is not necessarily coming from only Caucasians. It's coming from other races as well. And unfortunately, if you look at the healthcare system in Canada, there's very few black doctors in the system. It's growing now. In Alberta here, I think there's this growing number of black doctors. What I would recommend in this society, you know, when you expose certain things, people are afraid. And so 2 things that people need to really pay attention to. Number 1, if you feel that you're getting a treatment that is not right in the healthcare system, you have the ability to go for 2nd, 3rd, and 4th, and even if you have to go to 10 different doctors, you do that. Because the 2nd, 3rd, and 5th opinion, usually you will end up with someone who is empathetic. You will find someone who could now tell you, okay, this, what you're experiencing is not right. And now you have somebody who's on your side who can help guide you in the system. And that's where I'm saying sometimes, you know, we have a lot of community members here who tend to go towards the, Arabic doctors. And unfortunately, some of these Arabic doctors can be the most racist, actually, against Black people. And so be careful about that. If you really, and that's why, you know, when you see a doctor, pay attention to what they're telling you. Pay attention to how they're treating you. If they're rushing you, they're not paying attention, you stop them. And once you stop them, and you say, Flight mentioned something very important, record. This will basically signal to them that they have to be careful. So these are things that we can do. Yes, the system is you know, we have systemic racism in the country, but there are ways that we can expose these things, and we can be proactive about it. Pay attention to how people are treating you in the system. Look for 2nd opinion, 5th, 7th, and if you have like a good, you know, Black community doctors in your cities, look for those. Even if you don't, if they're not your primary care doctor, go seek their opinion and tell them, you know, I've been to this, I'm dealing with this, and this doctor is doing 1, 2, 3 things. Can you please tell me what I should do in this case? Most likely they will tell you. And there's a lot of, in Edmonton here, for example, we have a lot of, you know, Nigerian doctors now, and most of them are very upfront, and they come forward with, if you're experiencing certain things, they will tell you, do 1, 2, 3 things. So let's be our own advocates. Don't accept, you know, mediocre treatment and keep quiet about it. We need to be able to speak, and we need to be able to do some of these things that were shared here. Recording conversations, and you can tell them, I'm recording this because I'm going to seek more, you know, further information on this. They will be afraid to be more, you know, overt with some of these racism. So there are things that we can do and help, you know, address some of this, or mitigate a little bit some of this racism. And quite frankly, there are also some white people who are very helpful. They really want to address this issue of systemic racism, so look for those allies. Let's not feel like we're helpless, we cannot find support or things like that. There are things that we can do that can help us. So I just wanted to kind of leave us with this message as well.
Yeah, thank you very much for this advice, and just also, I think I have a good experience with these areas. When I came to Edmonton 2 years ago, I was looking for a family doctor. As you mentioned, those Arab doctors sometimes they could be the worst. I had an experience with that. I went to a doctor near, I think, Collection, something like that, behind the station there. The first moment that man saw me, he thought I'm a drug addict, homeless, and just the conversation was going to that line. I had to clear myself to him that I'm also a medical doctor, I understand what he's doing, and what he's saying all is not in line with what I'm here for. Then he said, okay, now I have a lot of questions on my list, I cannot have you as my family doctor, from my patient, you come to me after a month. Then I said, okay, bye. I left him. So that's real happened. Just because as my situation, he started talking to me in the line that I'm here to get prescribed narcotics. And all these questions just going to that line. But at the end I said, no, I have to tell him that I know what he's talking about. And I even one time in this place I was prescribed some those medication. There are rules for it, not just like that. Then from there he said, okay, I have a lot of people here now with me, you come to me next month. And then we separated.
Very good point. Today we've had a lot of things that comes in connection to what we're talking about. The business people say, be a go-getter, and this isn't health. It's your body. You can also be patient, get the best. So just pointing on to what Susanna mentioned was a great area of, good caution to us all. When I was showing about how to find a doctor, they've come up with a good program with primary care networks. Network is a bunch of other people, and it's actually a way to tell people to shop for their doctor. So don't settle, they look up, the West End. No. Just go. There could be a good doctor down the south, down the north, until you find your one and you understand. Because this is your health we're talking about. You need a person with empathy, who has those medical ethics and empathy to really handle you. So your life, you want to empty. You don't want to share with anybody. If he goes and rushes you through, just say, no, I was having a headache, I'm feeling okay now. Move to the next center. Thank you.
All right. Well, thank you both for taking the time to extensively actually answer questions candidly and speak to us with all of your experience and knowledge that you guys have. We're really grateful. And I think the point for us to take home is that what do we do, you and I, to make sure that we stay on top of our health? Whether it be advocating for our children, advocating for ourselves, advocating for our husbands sometimes, husbands are advocating for their wives. We look out for one another. I think when we do that in our household, we start to gain the power back. In the community, we start to gain. If language is a barrier, ask a sister. I think we can do that to empower one another and make sure that we're not dying because of negligence, but we're dying because it's our time. Because we all have the time, and when the time comes, we can't do anything. With that, it brings us to the end of our session, and I thank you both so profoundly. Thank you, both Flighty and Dr. Victor. Thank you for your time. We truly appreciate it.
Started with the youth, we went to adults, and now we talked about our health as adults and as human beings. So I think we're gonna end our day today with the information sessions. We're gonna end them today with this presentation. But before I move on, there is one of this on your table, and you can scan and just do evaluation for the day. Please be honest so we can be able to change things the next time. We're going to take whatever feedback you guys put here seriously, and we will try and implement it on the next conference. We've been sitting down for so long, and I think we're going to get up and maybe do some dancing a little bit. If the DJ is here,